Hi there. Today we're going to be talking about cardiovascular centers. Nervous control over HR is centralized within the two paired cardiovascular centers of the medulla oblongata. The cardio-accelerator regions stimulate activity via sympathetic stimulation of the cardio-accelerator nerves, and the cardio-inhibitory centers decrease heart activity via parasympathetic stimulation as one component of the vagus nerve, cranial nerve 10. During rest, both centers provide slight stimulation to the heart, contributing to autonomic tone. This is a similar concept to tone in skeletal muscle. Normally, vagal stimulation predominates as left unregulated. The sinoatrial node would initiate a sinus rhythm approximately 100 BPM. Both sympathetic and parasympathetic stimulations flow through a paired complex network of nerve fibers known as the cardiac plexus near the base of the heart. The cardio-accelerator center also sends additional fibers forming the cardiac nerves via sympathetic ganglia, the cervical ganglia plus superior thoracic ganglia T1 to T4 to both the sinoatrial and atrioventricular nodes, plus additional fibers to the atria and ventricles. The ventricles are more richly innervated by sympathetic fibers than parasympathetic ones. Sympathetic stimulation causes the release of the neurotransmitter norepinephrine, NE, at the neuromuscular junction of the cardiac nerves. NE shortens the repolarization period, thus speeding the rate of depolarization and contraction, which results in an increase in HR. It opens chemical or ligand-gated sodium and calcium ion channels, allowing an influx of positively charged ions. Norepinephrine binds to the beta-1 receptor. Some cardiac medications, for example, beta blockers, work by blocking these receptors, thereby slowing HR, and are one possible treatment for hypertension. Overprescription of these drugs may lead to bradycardia and even stoppage of the heart. So, cardio-accelerator and cardio-inhibitory areas are components of the paired cardiac centers located in the medulla oblongata of the brain. They innervate the heart via sympathetic cardiac nerves that increase cardiac activity and vagus parasympathetic nerves that slow cardiac activity. Parasympathetic stimulation originates from the cardio-inhibitory region with impulses traveling via the vagus nerve, cranial nerve 10. The vagus nerve sends branches to both the sinoatrial and atrioventricular nodes and to portion of both the atria and ventricles. Parasympathetic stimulation releases the neurotransmitter acetylcholine at the neuromuscular junction. Acetylcholine slows HR by opening chemical or ligand-gated potassium ion channels to slow the rate of spontaneous depolarization, which extends repolarization and increases the time before the next spontaneous depolarization occurs. Without any nervous stimulation, the sinoatrial node would establish a sinus rhythm of approximately 100 BPM. It becomes evident that parasympathetic stimulation normally slows HR. This is similar to an individual driving a car with one foot on the brake pedal. To speed up, one needs Merely remove one's foot from the brake and let the increase speed. In the case of the heart, decreasing parasympathetic stimulation decreases the release of acetylcholine, which allows HR to increase up to approximately 100 bpm. Any increases beyond this rate would require sympathetic stimulation. Input to the cardiovascular center. The cardiovascular center receives input from a series of visual receptors with impulses traveling through visual sensory fibers within the vagus and sympathetic nerves via the cardiac plexus. Among these receptors are various proprioceptors, baroreceptors, and chemoreceptors, plus stimuli from the limbic system. Collectively, these inputs normally enable the cardiovascular centers to regulate heart function precisely, a process known as cardiac reflexes. Increased physical activity results in increased rate of firing by various proprioceptors located in muscles, joints, capsules, and tendons. Any such increase in physical activity would logically warrant increased blood flow. The cardiac centers monitor these increased rates of firing and suppress parasympathetic stimulation and increase sympathetic stimulation as needed in order to increase blood flow. Similarly, baroreceptors are stretch receptor located in the aortic sinus, carotid bodies, the vena cava, and other locations, including pulmonary vessels and the right side of the heart itself. Rates of firing from the baroreceptors represent blood pressure, level of physical activity, and the relative distribution of blood. The cardiac centers monitor baroreceptor firing to maintain cardiac homeostasis, a mechanism called the baroreceptor reflex. With increased pressure and stretch, the rate of baroreceptors firing increase and the cardiac centers decrease sympathetic stimulation and increase parasympathetic stimulation. As pressure and stretch decrease, the rate of baroreceptors firing decrease and the cardiac centers increase sympathetic stimulation and decrease parasympathetic stimulation. There is a similar reflex called the atrial reflex or Bainbridge reflex associated with varying rates of blood flow to the atria. Increased venous return stretches the walls of the atria where specialized baroreceptors are located. However, as the atrial baroreceptors increase their rate of firing and as they stretch due to the increased blood pressure, the cardiac center responds by increasing sympathetic stimulation and inhibiting parasympathetic stimulation to increase HR. The opposite is also true. Increased metabolic byproducts associated with increased activity such as carbon dioxide, hydrogen ions, and lactic acid, plus falling oxygen levels are detected by a suite of chemoreceptors innervated by the glossopharyngeal and vagus nerves. These chemoreceptors provide feedback to the cardiovascular centers about the need for increased or decreased blood flow based on the relative levels of these substances. The limbic system can also significantly impact HR related to emotional state. During periods of stress, it's not unusual to identify higher than normal HRs, often accompanied by a surge in the stress hormone cortisol. Individuals experiencing extreme anxiety may manifest panic attacks with symptoms that resemble those of heart attacks. These events are typically transient and treatable. Meditation techniques have been developed to ease anxiety and have been shown to lower HR effects. Doing simple, deep, and slow breathing exercises with one eye closed can also significantly reduce this anxiety and HR. That's it, dear students, for today. Please subscribe to my channel, put your comments on comment section, and give me your likes. See you. Bye.